This week on Health across the islands, Puerto Rico and the Cayman Islands report cases of Cyclosporiasis, disease outbreaks in Cuba, Legionella bacteria detected at a Cayman Islands hospital, hand, foot, and mouth disease cases increase in western Jamaica, dengue cases continue to decline in the Dominican Republic. All this when we return on Health Across the Islands, your Caribbean weekly health news briefing. Thank you for joining us on Health Across the Islands, your Caribbean weekly health news briefing. I'm your host, Natasha Robinson-Connor. Puerto Rico and the Cayman Islands have confirmed their first case of Cyclosporiasis this year. The cases come as the United States investigates a much larger increase in infections caused by Cyclospora cayetanensis, a microscopic parasite that spreads through contaminated food or water. Thousands of cases have been reported across the U.S. this year, prompting investigations into possible contaminated fresh produce. Health officials in both countries have declared that the cases identified were imported, as the patients contracted the infection while traveling overseas. There is currently no outbreak within the islands. Cyclosporiasis typically causes prolonged watery diarrhea, stomach cramps, nausea, fatigue, and loss of appetite. Symptoms usually begin about 1 week after exposure and can last for several weeks or even months if left untreated. While the case fatality rate is very low, the main risk to life is severe dehydration resulting from prolonged watery and explosive diarrhea. Public health officials continue to remind residents to wash fresh fruits and vegetables thoroughly, practice good hand hygiene, and seek medical care if persistent diarrhea develops after traveling or eating potentially contaminated food. Last week, we brought the story that the prolonged electricity outage in Cuba is affecting their medical system, but now we have another issue. There is currently an outbreak of gastrointestinal diseases in the population. Frequent blackouts have disrupted water pumping, food refrigeration, and sanitation, forcing many residents to store water for extended periods or use unsafe water sources. Public health professionals continue to stress that reliable access to clean water, sanitation, and electricity remains essential for preventing disease outbreaks. We will continue to monitor the situation in Cuba. Health authorities in the Cayman Islands have confirmed that Legionella bacteria has been detected within the water system at the Health Services Authority Hospital. Officials say that there have been no confirmed cases of Legionnaires disease linked to the hospital, but precautionary measures are already underway to reduce any potential risks. These come after reports of a resident contracting Legionnaires disease locally. Legionella naturally occurs in fresh water but can multiply inside building water systems when conditions allow. People become infected by inhaling tiny drops of contaminated water rather than through person-to-person spread. The hospital has increased water testing, flushing procedures, and disinfection efforts while continuing to monitor the situation closely. Officials have reassured the public that patient safety remains the top priority. Health officials in Jamaica's Westmoreland parish are reporting an increase in hand, foot, and mouth disease, HFMD, particularly among young children. This after confirming earlier in April that no cases were observed. HFMD is a highly contagious illness among infants and children under the age of 5, caused by enteroviruses and spreads easily through coughing and sneezing, saliva, nasal secretions, contaminated surfaces, and close contact. Typical symptoms include fever, sore throat, painful mouth sores, and a rash on the hands and feet. Increased cases of HFMD are generally reported between March and June and September and December across the Caribbean. So far this year, the Caribbean Public Health Agency, CARPHA, has posted an alert to its member states warning about HFMD, while the Cayman Islands has added it to its list of notifiable diseases. Frequent hand washing, cleaning shared surfaces, and avoiding close contact while ill remain some of the most effective prevention measures. And finally, some encouraging news. The Dominican Republic is reporting a continued decline in dengue cases compared with previous years. Health officials say strengthened mosquito control programs, increased community awareness, and improved surveillance have all contributed to the reduction. Despite a positive trend, authorities continue encouraging residents to remove standing water around homes, use mosquito repellents where appropriate, and seek medical care early if symptoms such as high fever, severe headache, muscle pain, and persistent vomiting develop. With the Caribbean remaining vulnerable to mosquito-borne diseases throughout the rainy season, continued vigilance will be essential to sustain this progress. They have also reported a decline in leptospirosis cases. Those are your Caribbean public health headlines for this week. Have a safe week.